Hi, my name is Paul Ursell. I'm a consultant eye surgeon from the UK, from London, and I'm just talking about a paper I've just presented here at ESCRS in Lisbon. So this is a 3-year retrospective analysis of YAG rates and PCO in a large cohort of patients that we got from the Medisoft database. So PCO is something that happens a few years after surgery and it's thought to be related to the IOL polymer. So what we'd like to do is look to see whether this was the case in real-world data. Now, in the UK we have the Medisoft database, which is a comprehensive database written by an ophthalmologist, a friend of mine called Rob Johnson, who died recently. And what it does is it records a comprehensive patient record of everything that happens: so biometry, vision, surgery, IOL, and then when the patient comes back to clinic, again all that same data is recorded, and then where they had a YAG laser. Also, one of the problems with retrospective analysis of databases like this has been whether the patient actually did come back to you and whether it was recorded. So what we did is we looked for UK centres which were using the Medisoft database, which were also very comprehensive, and they were making sure that everything was recorded onto it, and that they were the only people in the area with a YAG laser. So if the patient did develop PCO, they would come back to them to have the treatment. Otherwise, they'd be leaking out to other units. So we found 7 units in the UK, and we got all their data going back from 2000 to 2010. We pulled that together and got us 240,000 cases. Once we looked at monofocal lenses placed in the bag with 3 years worth of follow-up, over the age of 65, that whittled it down to 52,000 cases. We had 10,000 acrysofts, 19,000 hydrophilic acrylics, and about 19,000 again hydrophobic acrylics. And what this showed, when you looked at 3 years worth of data, is that acrysoft lenses had a 2.4% chance of a YAG laser capsulotomy, hydrophobic acrylics had a 4% chance, and hydrophilic acrylics 10.9%. So this shows that the overwhelming factor influencing whether a patient has a YAG after surgery is the IOL biomaterial. There were some other incidental findings. If there's any complications during surgery, this would increase your chances, but this was very low numbers. The thing that surprised me was how little effect age had. We took out patients under the age of 65, so our database only had those over 65, but age hardly had any effect at all, which I was very surprised about, which I think we're going to look into in further detail. So it was well received and it was a good study. The take-home message was that the main thing affecting PCO after cataract surgery is the IOL biomaterial, and acrysofts seem to perform better than hydrophobic acrylics, and certainly better than hydrophilic acrylics. Thanks.